From October 1st to November 12th, 2025, the federal government was shut down. 43 days. The longest shutdown in American history. Longer than the 35-day shutdown in 2018-2019 over border wall funding. For those that need the reminder, Trump was president then, too. This time, here's what happened. Senate Democrats refused to pass a continuing resolution unless Republicans agreed to extend the Enhanced Affordable Care Act premium tax credits. These credits have been in place since 2021, keeping health insurance affordable for millions of Americans. They were set to expire, and Democrats drew a line in the sand. For 43 days, over 700,000 federal employees were furloughed. Another 730,000 essential workers had to work without pay. The Congressional Budget Office estimates the economy took an $11 billion permanent hit. SNAP benefits were threatened. Flight delays cascaded through the system. The IRS shut down half its operations. And in the end, Democrats got nothing. Well, almost nothing. 8 moderate Democratic senators crossed the aisle and voted to reopen the government. The deal had one clause that allowed federal workers to be paid again and operations continued at the current level. But also in this deal, they got a promise, just a promise, of a December vote in the Senate on health care subsidies. No guarantee it would pass. No commitment from the House to even bring it to a vote. Surprise, surprise! Majority Leader John Thune kept his word. There will be a vote. But Speaker Mike Johnson has made no such commitment for the House. And President Trump has been signaling opposition to extending the subsidies, floating alternative proposals like health savings accounts that would do nothing to help people who can't afford coverage in the first place. So what did Democrats accomplish? They elevated the issue. They made Republicans own their opposition to affordable health care. But 22 million Americans are still staring down a cliff. The health care crisis Congress is ignoring, or rather, Mike Johnson is refusing to acknowledge. Let's be crystal clear about what happens on January 1st if Congress doesn't act. According to the Kaiser Family Foundation, premiums for ACA marketplace coverage will more than double on average, a 114% increase. The average subsidized enrollee currently pays about $888 per year. Without enhanced credits, that jumps to $1,904. Now, that's going to be for a guy, and I think that's pretty conservative. The real devastation hits specific groups the hardest. A healthy 60-year-old couple making $85,000 a year, this is according to the Kaiser Family Foundation again, that's just above 400% of the federal poverty level, could see their annual premiums jump by over $22,600. That would make their health insurance cost about a quarter of their entire income. That's not a typo. A quarter of their entire income just for the privilege of having health coverage. And again, this is affecting women disproportionately. We have always paid more in healthcare costs. The estimate for a woman in their 50s, this is a monthly estimate, not annual, monthly premium estimate if these credits expire will be close to $3,000 a month. And it's not like the estimate considers the possibility of maternity costs in that $3,000. If someone has a pre-existing condition, it can't be denied, but they can be charged more. And they are. The Congressional Budget Office projects that if credits expire, marketplace enrollment will drop from about 23 million to under 19 million next year. Nearly 4 million people will simply become uninsured because they can't afford coverage.